I think the real payoff is going to be when we figure out how to pay for improving health. Right now we pay for providing services to people who are sick. You make money off your patients that have complications. You lose money if your patient stays healthy because they come in less often.
Okay, say like if I did have health care, I paid $300, but they billed the insurance company for $3,000, you know, as compared to me just completely paying $600. I just think it'd be so much better, you know, if I had insurance, you know, I paid $200, the insurance company pays $400, and then they could redistribute a lot of that money into a lot more preventative care and screening year-round.
We all know, I mean, there's a common ground. You've got good principles. We know what the issues are, but we need to start. We need to have a plan, and I think the biggest barrier is understanding who moves that plan forward with what authority. And that really is a concern. We all are really focused on so many individual issues, so it's beyond rolling incrementalism or disjointed incrementalism. It's now, with all of this, what's the plan that we can work on together?
And at least in our group, and probably in this group as well, consider healthcare more a right than a mandate. So if the underlying principle is that it's a right, then the delivery system by which it can be administered to people could be in any number of different ways, and it doesn't necessarily have to be by mandate, but it's sort of like putting together a system that makes sense for everybody, that's affordable, will effectively fulfill the right to health care that we have, similar to the right to education that we have in our country.
Okay. I think we have a couple of other ideas up here, but I think we've gotten pretty far. Is there anything else anyone feels really needs to be on this list? Let's read it.
I'm Graham Bailey with Blue Cross and Blue Shield of Kansas. And it's pretty obvious I'm going to have a fun day today. You can't allow people to say, hey, I just found out I have cancer, I'm 3 months pregnant, and let them call up and get an insurance policy. And the reason is, if you could do that, why would any of us pay whatever we pay per month? If we knew I'm not going to pay that when I'm well, I'll wait till I get sick and pay for it. So that's kind of the philosophy of underwriting. As Commissioner Prager said, the insurance industry, not only Blue Cross Blue Shield, but the American health insurance people, have all said that once you create a scenario or an environment where everyone has to have health insurance, then to be a health insurer in that environment, you have to agree to take everybody without any underwriting at all. And insurers can do that because when we take on the person with cancer or whatever, we're also getting forced into the system the 5 to 10 people who are healthy that chose not to get health insurance. And that creates the community pool. Community rating is great. Blue Cross Blue Shield of Kansas started out with community rating, but then somebody came in and said, okay, Blue Cross Blue Shield charges so much, we're just going to go out to the people and underwrite and just take the healthier ones for less money. And that leaves the people in community rating, their rates just go up and up. As long as everyone community rates, then it's fine and no insurer would have any problem with it.
Okay, so what do we do about all of this? Do we want to move in a different direction? Are there pieces of this we want to maintain? Are there things we want to change? What future do we want to see?
We all pay taxes to bring about the common good, and some of us call it socialism, others call it, democracy.
So, would you say that a negative would be that there is a preconceived idea that any single-payer government-run system won't work?
Exactly.
Is that a negative? I mean, it doesn't mean it won't. I'm just saying that's
yes,
the perception.
The perception, definitely, I think, is a negative, is the perception. A fear of socialized medicine.
Right, and I think that the perception is that if you do something like this, then we become, instead of a democracy, we become a socialist country just because we're trying to have a consistent universal system for care. And everybody jumps to this, oh my God, we're turning into a socialism. We're looking at socialism here, which it's sort of like, just overt fear over something that potentially could happen 100 years from now just because we're trying to take care of people who need health care.
I may be the only one who agrees, who feels this way, but I just want to say it to put it out there. Using Massachusetts as an example, Massachusetts is a state that already spends more per person than any state in the country, and they put another $1.5 billion into paying for medical care with essentially nothing on the accountability side for efficiency and quality. And if we do that in our country, I think it will be a huge mistake. We already spend twice as much per person as the other developed countries, the next highest developed country. If our approach to it is just to put more money into it, there are costs of that.
The situation we're in right now with people losing jobs and losing insurance as a result just really hits home the importance of insurance being something we have individually, and but it has to be affordable. So these are not easy tasks, but I think we have an awful lot of folks who are looking at solving the problem and whose I think hearts are in the right place. I think it can happen. I'm very optimistic.